Hello dear viewer and karibu once again to another episode of Health Nuggets. As always, my name is Aida Munzati, and as I always say, your health matters. So welcome to this episode of Health Nuggets. For this episode, we are generally going to look at the ear, looking at hearing loss, the causes, the signs, the diagnosis, treatment, and above all, the management. So as mentioned, we are looking at the ear, and we are coming to you from Nairobi Audiology Center. And on set, I'm being joined by Dr. Sarah Ndegwa. Daktari, karibu sana, and thank you so much for your time. And we look forward to learning from you. Yes, so just looking at the topic today, what exactly do you do here in relation to what we'll be discussing today?
So welcome to Nairobi Audiology Center. Here we provide hearing and balance solutions. So we provide diagnostic hearing assessments and rehabilitation for those with hearing problems, as well as also people with balance problems and vertigo, as it's commonly called. We provide diagnostics and rehabilitation for that.
Okay, now before we get into it, I'm sure you came into the market because there was definitely a gap. So from where you sit, what is the prevalence, let me say, of hearing loss? Let's just say maybe in Kenya, if you have the numbers, that is.
The prevalence of hearing loss in Kenya is estimated between 6 to 8%. Globally, WHO report says that 430 million people in the world have disabling hearing loss. 34 million of those are children. So disabling hearing loss is that hearing loss that actually is a problem in your everyday functioning. And yeah.
Now let us just look at maybe how hearing loss comes about. Maybe we can just look at the causes of now hearing loss.
Okay. So in terms of the causes of hearing loss, we can look at it from the pediatric population, that's the children, and also the adults. So for a mother who's expectant, if she has certain conditions, it can lead to hearing loss, such as, for example, measles in pregnancy, or maybe she took some medications that are toxic to hearing. Those are some of the things that can give you hearing loss when the child is not yet born. And then at the time of being born, difficult deliveries, the child was not able to breathe very well at the time of delivery. And then soon after delivery, some of them get very, very severe jaundice or very, very severe infections. Potentially that can lead to hearing loss. Also low birth weight, that is children who are below the age of, low birth weight, babies who are below 1,500 grams. Also prematurity also can predispose or put a child at risk for hearing loss. And also there are those genetic kind of hearing losses as well that can give you that hearing loss. And other infections such as meningitis, severe malaria, especially when you have certain medications like quinine, which we call ototoxic, can lead to that. As one gets older, there are other ear infections. We call them otitis medias. They can be those ones with a discharging ear, which is one of the commonest in our communities. And you can get fluid also in the middle ear as well. That is another type of middle ear infection. And then you can get inner ear problems, and those ones are usually caused by, let's say, noise-induced hearing loss, the process of getting older. We mentioned earlier genetic causes, and then drugs like, we call them ototoxic drugs, and then certain conditions can also predispose you to hearing loss, such as labyrinthitis. Those are the common causes of hearing loss, yeah. And noise is one of the big ones, yeah.
Okay. Now, I want to believe we went too fast, yeah? You have a dummy here that is of a representation of how the ear looks like. Just take us through over, let me say, the anatomy or the parts first.
Okay. All right. So the ear is divided into three parts. You have the outer ear, which is the part that you can just see right there. And if you go down the outer ear, you find the ear canal. And from there, you get the eardrum. So the eardrum is slightly deeper in there. The eardrum is mobile, so it moves. When its sound comes in, it vibrates and sends that sound into the middle ear, where you find there's some 3 bones right there. And that sound is then transmitted into an organ which we call the cochlea. So generally the ear is in 3 parts. You have the outer ear up until the eardrum, the middle ear. The middle ear is connected to the nose and throat through a tube that's known as the eustachian tube. And then you have now the inner ear. The inner ear has 2 main structures. One is the cochlea, that is the organ of hearing. And then we have the vestibular system, which is the organ of balance. And then from there, information from the 2 is relayed through this nerve all the way to the brain. Yeah.
Okay. You just mentioned of the infections, the different infections, or let me just say diseases. You can just tell us what parts are now affected by these infections that you mentioned.
Okay, so we have the outer ear. The common things that can happen in the outer ear would be like wax. So wax is easy to manage. Once wax is detected, you just have it cleaned out, either removed or syringed out. You can also have infections just around there, like a boil or something that can also be treated. Very common is with children having foreign bodies, putting foreign bodies in the ear. Again, the only thing to do there is just to have it removed. And then you have the eardrum. The eardrum, when it can have a perforation. A perforation means there's a hole in the eardrum. How that happens, you can have an infection. And once you get that infection, we call it otitis media, chronic otitis media. Then discharge can come out from there. Then you can also have a situation whereby trauma, somebody, let's say you get a slap, because of the pressure to the ear, then this can rupture. The eardrum can rupture or get a tear. You can also get fluid, which is very common with children, especially after a cold or throat infections, tonsillitis. All those things can create, or even nasal problems, can create fluid in the middle ear. So how that one is managed, usually with treatment, but sometimes when the fluid is quite a lot and causing significant hearing loss, then the ENT surgeon will remove that fluid and insert something we call a grommet. So the procedure is called laryngotomy and grommet insertion. So there are also other conditions that can give you a hearing loss which happen in the middle ear, like these bones. One of them can be stiff, or maybe it can be dislocated, especially after an accident. That can give you a hearing loss. So problems that are in the outer ear and in the middle ear are mainly managed medically or surgically, depending on the extent and what it is. Then you have the inner ear problems. In the inner ear, this is where you have some very tiny hair cells. We call them hair cells, which when the sound comes in, they're the ones that pick that sound and take it all the way to the brain, and then you are able to hear. What can affect hearing here is conditions such as, for example, infections like meningitis, labyrinthitis, infections like that. Also, you have the aging process. You have the noise-induced hearing loss is one of the causes of loss here. Drugs, certain medications, like for example quinine, and certain cancer treatments, they can cause a hearing loss. Yeah.
So you just mentioned that it's easy to treat infections of the, let me say, the outer ear and the middle ear.
Yes.
So why is it so difficult or to treat now infections or diseases of the inner ear?
It's not really difficult per se, but what happens is that the loss that you get because of inner ear is usually permanent. In other words, it's not reversible. And so for that, depending on the extent of it, so we normally do a hearing test. The hearing test helps to determine for each ear what is the level of hearing. So we call that audiometric test. So once the test is done, then we see you have a mild hearing loss, or do you have a moderate hearing loss? Is it severe or profound? Now, because it is in the cochlea, the loss is emanating from the cochlea, it's not reversible. So to the extent that you have a problem, we will help with that. And that usually is the use of hearing aids. And this is what a hearing aid would look. There are very many different types of hearing aids. This is just one such type. This is called a receiver in the canal hearing aid. It fits snugly in the ear and will show you. So the basics of a hearing aid has got a microphone which picks up the sound, and then an amplifier which magnifies the sound, and a loudspeaker. And then you're able to hear. And so it's measured, the power of this is measured based on the loss. And we normally just do it, it's a fitting is done, you know, like via computer. And the hearing aids that we have today are very versatile. They can be able to be adapted to all sorts of environmental conditions or situations or noises. They have noise management features, feedback cancellation features. They're digital instruments. They're really good. And also they are very, I think they're beautiful. Fancy. And they're fancy. Yeah. And they're rechargeable. The ones that we provide nowadays are rechargeable. You don't need to use, the regular batteries. Although if one needs to use that one, it's still okay. Then there is a category of people who the hearing loss is profound, which means that in the inner ear, those hair cells that pick the sound, like 90 to 95% of them are damaged. So the best benefit for that is to do cochlear implantation. So cochlear implantation, what comes in two parts. There is the internal component. This one is an electrode array that is inserted surgically into the cochlea. So it takes over the role of the cochlea. The hair cells that are inside there, they are tonotopically arranged, which means that some of them are sensitive to low frequency sounds, some mid frequency sounds, and some high frequency sounds. So this electrode array, which is inserted inside there, is arranged in a similar manner so that when sounds come of low frequency, they're able to be picked. So after the surgery is done, about a few weeks later, then now we come and attach the external part. The external part is known as a speech processor. The speech processor picks up the sounds and then relays it into this coil cable here as a digital signal, and then through this coil, which is then attached through a magnet. It has a magnet which then attaches it to the internal component, and then the person is able to hear. And so there are many different styles. There's this one. There's also one which is just one unit. It's known as the rondo, and that one just sits like that. But this we prefer mainly for older children or adults. And then an intense rehabilitation process for speech and language development.
I'm sure you're going to explain to us even better using the screen as you mentioned, but let us look at the science. How do I tell that I'm losing my ear or I'm having a hearing problem?
Okay. The telltale signs are, for example, in children, delayed speech and language is one of the big telltales. And even long before that has even happened, you'll find that a child sometimes is not turning towards sound. Even very loud sounds, they're not turning towards it. And if it's an adult, for example, you have to keep asking someone to repeat what they have said. You miss out a lot of things in conversation. That already is a telltale sign that you're having a hearing loss. And then for others, and especially adults, they will also have started off by saying that I can't exactly understand what somebody is saying. So it's not just also not hearing, but not also clarity of what someone has said, because some parts of hearing are affected, let's say the high frequency parts. So you can hear what people talking, but you can't understand what they are saying. So that's also another telltale that is likely to be a hearing loss. Also tinnitus. Tinnitus is a sound that you hear in the ear. It could be a ringing sound. That can also be an indication that is likelihood of there being a hearing loss. Yeah.
And among what you've mentioned, which one is more prevalent, maybe in the adults and the children?
In terms of who are more
affected. Yeah.
Like we say, the WHO report of 2020 indicates that 430 million people have disabling hearing loss. Of those, 34 million are children. So for children, some of the effects are, like we said, delayed speech and language development, also poor academic performance, difficulties in social integration. And for adults, it has even been found that it has a likelihood of cognitive decline, having cognitive decline sooner than one would have as a result of hearing loss. And as well as, with hearing loss comes a lot of social isolation. There's also stigma that is associated with it because people say you don't understand it. They take it, you just don't understand. But the thing is, you're not hearing. It's not that you don't understand, it's that you're not hearing. And the good news, obviously, is that something can be done about it. Yeah.
Okay, and talking of stigma, you just mentioned of us or the world marking World Hearing Day. That's sometime around
3rd of March every year.
Yes. So what exactly was the message, and from that message, what was the main cause that was realized to be leading to now hearing loss?
So the World Hearing Day is commemorated every year on the 3rd of March, and we did that this year. The main message was making listening safe, and we were trying to create awareness of the hazards of exposing yourself to very loud sounds, and what you can do also to protect yourself from very loud sounds if by nature, the nature of your job is, you're exposed to very loud sounds, what you could do. So, but then coming back to safe listening, we talk about even just using your devices, the devices for hearing, earphones, AirPods. One should always listen to using them to sounds that are no more than 60% of the volume. If you use it at full volume every time, or especially if you're using them and the person next to you can even hear what you are hearing, then it's too loud. You already know it's too loud. The problem with that is that when you expose yourself to that, the hearing loss doesn't always happen immediately. Majority of the time, it is a gradual process, so you don't even realize it. And so prevention then becomes always better than cure. So if you're using personal devices, hearing devices, always make sure that you're using no more than 60% of the entire volume. Some of those devices that come in today are checked to such an extent that if you begin to cross that mark, they can, begin to make some sound to let you know that, give you a warning. Yeah, so then, but if by nature of your work, you're working in a place that is very noisy, sounds that are over 85 decibels, especially over an 8-hour period, will definitely give you a hearing problem. And so in order to protect yourself from that, you can use earplugs or earmuffs. I have a sample of the earplugs or noise plugs. So these ones, when you insert them in the ear, what they do, they reduce the sound intensity that is getting into your ear. So if, let's say, you're in an environment of about, let's say, 90 decibels of sound or even 100, these ones can bring it down by 30 dB. So then, although you will hear the sound, but it is very much reduced. So for the time that you are in that exposure, now you wear the noise plugs.
So
you just insert them like that. That's it. The noise plugs reduce the sound intensity by around 30 decibels or so. So if you're in a place where the exposure is very loud, you can imagine like in a factory, it's 120 decibels. So when you reduce it by 30, it comes to 70, it is still safe. Because more than 85 decibels is what is not safe. So you just insert them in the ear like that. That's it. So for the period of time that you're in that exposure, then you use the noise plugs. Sometimes people ask about how can I know how noisy my environment is. We do have some apps that you can download, and one of them is there's a WHO app, and there are also very many other apps that you can download that are able to tell you the environmental noise level that you're exposed to, so that you may know when it is too much and use noise protection. So you have this, and you also have earmuffs. Those ones are available, but mainly I think they're used by those people who have occupational noise, very loud noise exposures. Yeah.
Okay. So earlier on we had mentioned a little about, let me say, the management and the treatment and the diagnosis. Let me say I walk in to Nairobi Audiology Center with I don't know whether to undiagnosed hearing problem. At first, what exactly do you do?
Okay, so when you come, usually it will be your history. We'll do a history from you and ask you what are the challenges that you're experiencing. And is there any pain in the ear? Do you have any ringing sounds? Is it that, what have you noticed? I can't hear very well. If it's a parent bringing a child, we'll say my child has not developed speech and language, or has developed but has delayed. So then the next thing we're going to do is to do an ear examination. We want to check out whether there is any wax, and because there are also simple things that we said that can be done. If it's wax, we do wax removal, syringing. If it's foreign body, it's removed, and so forth. Then the next thing is a hearing test. So we have a hearing test which is known as audiometry. The audiometry test basically tests every frequency of speech. And usually it is arranged between 250 hertz and 8,000. So as we are testing, we want to determine at each one of those frequencies what is the level at which you're hearing, the quietest level you're able to hear. From that, we make what you call an audiogram, and then we can say your level of hearing is mild, your level of hearing is moderate, as well as also from that, we can tell where is your problem. Is it in the outer ear? Is it in the middle ear? Is it in the inner ear? That helps us to do that. Then for little babies, a child can be assessed for hearing even when they are very, very young as just soon after birth. We call that newborn hearing screening. So we also do newborn hearing screening. Now, this being a clinic, they will come probably after a week or 2 weeks or so. But the same screening can be done even at maternity. So we also do newborn screening. We just want to see is the child hearing or not. Any age can be assessed. And should we find a hearing problem, then we go on to now do the rehabilitation, as we said. We have the hearing aids, and if it's profound, then we go towards cochlear implants.
So just show us how now the hearing aids work. Now how just the way you've connected them from the laptop to the screen.
Yeah, we connect this one, the hearing aid. We connect the hearing aid, and now we put it on the patient's ear, and I can demonstrate for you. So as I said, there are very many different types. So there, I just put it right into your ear. You'll hear it whistle a little bit. And then this one goes right behind your ear like that. There we go. And I do the same for the other side. And then now I begin to program it, make sure that the sound is not too, it's comfortable for you, and that you're able to hear speech. Taking care of the gap that you had in your hearing loss, you're able to hear speech. The beauty of these hearing aids, you can use your phone to make different changes on it. You can also be able to stream music. You can also receive your telephone calls. So we give you an app which then is able to communicate with your hearing aid or stream to your hearing aid, and then you're able to hear. Yeah.
Okay. Now, just a question. I'm wondering about the waves. Yeah.
Yes. Yeah.
So how exactly do you determine that?
So what we do, the first thing that one does is, number one, you put in the hearing test. So we're going to do a hearing test, and then we feed in that hearing test into the, into the program. And then we apply what you call a fitting formula. That means how much amplification do you need? So once we've applied that, then we begin now to program it for you in various environments. As I play for you different words, I do a speech test for you, and I see how you're able to hear. And if you're not hearing well at certain levels or frequencies, then I give you the amplification that you require. So the waves that you're just seeing are the responses of the hearing aid to soft sounds, that is very quiet sounds, that is the blue line. Then you have also the green line is for conversational sound. How do you hear conversational sound like we are speaking? And then the darker line is the very, very loud sounds. How do you hear? So the hearing aid is really supposed to give you sound that you can hear, but comfortably. It's just right, not excessive, just right. So that is why it's important to do an individualized or customized fitting on a patient.
So I cannot definitely use one that has been prescribed for someone else.
Yes.
All right.
Yeah.
Now, there is a lot that we can talk about the ear, and we can definitely not complete everything within 30 minutes. So that's why I invite you on our next episode of Health Nuggets, where we'll be proceeding or just continuing with today's conversation about the ear. Remember, we have looked at the ear generally, how it performs, the signs or the telltale signs of these infections. And in the next episode, we will be looking more or just delving further into the treatment, diagnosis, and management. Thank you so much for tuning in. If you're just joining us, remember you can always find this episode of Health Nuggets on all our social media pages. That is CAC TV Kenya on Facebook and YouTube. My name is Aida Munzati. As always, your health matters.